I'm sure everyone here knows someone with diabetes or hypertension. I do too. The person you're seeing here is my uncle. He had diabetes, but he never knew he also had a circulation problem. By the time it was detected, it was already too late. He passed away after an amputation caused by peripheral arterial disease. This disease occurs when blood no longer reaches the leg properly, and many times it doesn't cause symptoms until the damage is irreversible. The problem is not that the treatment doesn't exist. The problem is that it's detected too late. And this is not an isolated case. It is a silent crisis. In Mexico, approximately 15 million people live with peripheral arterial disease. Every year, more than 220,000 people die from heart disease. And worldwide, more than 230 million people are affected. This is not rare. This is massive. And still, it's not that the tools don't exist. Today, clinicals use the ankle brachial index, the Doppler, and the ultrasound, but they all have limitations. The ABI may not be reliable in diabetic patients with calcified arteries. And in Mexico, diabetes is the second leading cause of death. Doppler requires specialized equipment and trained personnel, and it is not always available in public hospitals. The solution exists, but they are not solving the problem of access and early detection. That is why we developed BasilView, a non-invasive device that allows real-time visualization of blood flow signals in all four extremities. It does not rely on just a single number. It allows clinicals to observe the complete psychological signal. It is portable, it is accessible, and it is especially designed for environments where Doppler is not always available. Our goal is to close the gap between basic ABI screening and specialized vascular systems. That is why we developed BasilView, a non-invasive device that allows real-time visualization. As you can see, BasilView captures five signals simultaneously. We measure blood flow from the fingers of both hands and toes of both feet and the heart. This allows us to obtain a complete and synchronized vascular analysis in real time. Instead of evaluating only one point in the body, we observe the full peripheral circulation response at the same time. The simultaneous measurement provides better comparison between extremities and helps identify asymmetries that may indicate peripheral arterial disease. This is not just a number, it is a comprehensive psychological picture. Basilview was developed by four biomedical engineering students. We worked directly with the National Institute of Cardiology, which allowed us to understand the problem from a real clinical environment. We are also supported by academic and technical advisors. This is not just an academic idea, it is a clinically grounded solution with professional supervision. Our ambition is clear that no patient ever loses a limb again because of late diagnosis. We want to democratize vascular assessments in Mexico, starting with public hospitals and later expanding across Latin America, because access to early detection should not depend on a hospital budget. Our implementation strategy includes three steps. First, pilot clinical validation in tertiary public hospitals and academic institutions, generating comparative evidence against Doppler. Second, initiating the regulatory process with COFEPRIS, along with a small batch production of for control testing. And third, rapid training of medical staff, ensuring the test can be performed in minutes and is easy to interpret. Our model is business to business. We sell directly to healthcare institutions. The purchasing decision involves direct users, clinical leaders, procurement departments, and institutional payers. This is why our strategy is not just to sell a device. It is to generate a clinical evidence, demonstrate cost savings, and facilitate hospital adoption. Peripheral arterial disease does not always warn you, but its consequences do. Amputations, cardiovascular complications, preventable deaths. That's why Basilview was created to detect you earlier. Because every heartbeat matters, and every timely diagnosis can change a story. Today, we're here to take the next step, and we're ready. Thank you so much for your attention.